Hello and welcome to Eskimo TV. I'm talking today to Dr. Bob Chatterjee. Dr. Chatterjee is a consultant spinal surgeon and director of the North London Spine Unit. Hi, Dr. Chatterjee. How are you?
Hello, Joan. I'm very well, thank you.
Wonderful. Dr. Chatterjee, today we're talking about a spinal fusion. So what is a spinal fusion?
Well, a spinal fusion is when we artificially connect two of the vertebrae together, usually using either some artificial bone or the patient's own bone to try and mimic sort of healing between two bones to abolish abnormal movement.
What are the different methods of spinal fusion?
In general, there are three ways of doing it. You can either fuse a bone without using any metalwork or implants. That's usually done by placing some artificial bone graft at the sides of the spine after you roughen the edges a little bit to sort of try and make the body believe that it's recently been broken and therefore start the healing process. Another common method of doing it is supplementing that method by putting in metal screws and rods which fix into the back of the spine, rather like an internal scaffold to hold it together. The final type is to add a further implant, this time in between the vertebra where the disc normally resides. And we would normally excise the disc and place the metal implant inside. Those are the three principal methods.
So what are some of the reasons why a person may need a spinal fusion?
Well, there are a whole host of reasons, but typically you can use a spinal fusion for treating a fracture, many of which heal by themselves, but sometimes if they cause the spine to become unstable, then we might supplement the natural healing with a fusion. Sometimes if the bones are out of alignment, a term called spondylolisthesis, we would also fuse the spine to maintain the alignment. You can also fuse the spine if you have problems with the discs and the joints of the back. I think it has to be said, though, that spinal fusion for non-specific back pain is quite controversial. There are many studies that actually suggest it may be no better than conservative or non-operative measures. So one has to be quite careful about the reasons for which one may undertake fusion.
So what can people expect after the surgery? How will daily life change?
Well, typically, first of all, you're in hospital for somewhere between usually 3 and 5 days. And then when you go home after hospital, your wound is kept absolutely watertight and dry for about 2 weeks, so you're not allowed to bathe for that period of time in that area. Then after that, really, we start to do the rehabilitation work, which usually lasts somewhere between 6 to 12 weeks. And what we do is we do a combination of physiotherapy, gradually increasing the range of activities you can do. I think it is important to remember that there are certain restrictions that one should adhere to after spinal surgery. And that includes not doing any heavy lifting of weights or any torsion of the trunk, because that will impair with the healing of the fusion. But generally, I think spinal fusion is a fairly safe procedure, and patients can expect a significant reduction in their symptoms after such a procedure.
So how well do spinal fusions work, and what are the possible risks or complications?
That's quite a hard question to answer, and the reason is because that there is such a myriad of reasons as to why people might have the spinal fusion. There's been quite a lot of important studies to look at the outcome of spinal fusion for different conditions. So, for example, if you look at spinal fusion for degenerative disc disease, and on the whole the results are fairly average. But there is some clear evidence that spinal fusion in the treatment of fractures and the treatment of malalignment of the spine is actually very good. The procedure by and large is quite safe, but there are significant complications, although not common, that the patient needs to be aware of. The one I think that is most commonly asked is about what is the risk of significant spinal cord or nerve damage. The risk of spinal cord damage in these procedures is about 1 in 450. The risk of nerve damage is more common, although usually transient. It tends to be about a 1 in sort of 20 or 30. There are other risks such as infection. There are risks of developing blood clots in the legs and the heart. But by and large, I would say that most patients would go through a spinal fusion without too much difficulty.
Thank you, Dr. Chatterjee. Thank you so much for talking to me today.
Thank you very much indeed.